Hi, Prevent viewers! This month is National Immunization Awareness Month. Immunization is the process by which a person is made immune to certain diseases. Vaccine shots are given in order to make individuals immune to certain diseases or infections caused by viruses or bacteria. So basically, if you get the shot, aka vaccine, you reduce the risk of ever getting the disease. Pretty awesome! Some common or well-known vaccines are the flu shot, the measles, mumps and rubella, and the polio vaccine. Immunization is a very important and a really good way to protect your health and the health of our communities by limiting the spread of disease. In today's video, we're going to dive into things you should know about the HPV vaccination. First, let's briefly go over what exactly is HPV. HPV stands for human papillomavirus. It is made up of more than 150 types of the virus, which can affect all people. Among all these types, there are more than 40 that can cause different types of cancer. Cancers caused by HPV include cervical cancer, vaginal cancer, vulvar cancer, penile cancer, anal cancer, and back of the throat cancer. HPV is a very common virus that affects teens and adults, and it's the most common sexually transmitted infection. It can be passed on from one person to another during sex, even if the person does not experience any signs or symptoms. There is no cure for the virus, and as mentioned before, it may lead to cancer or genital warts. Now, let's get into the brief history of the HPV vaccine. Cervical cancer used to be the #1 cause of cancer deaths among women. Now it is one of the most preventable cancers. This is thanks to the HPV vaccine and cervical cancer screenings, which is when you go to the doctor every year or every few years to make sure you're healthy. The HPV vaccine was first introduced to the US in 2006. That's fairly recent. Since then, it has gone through some changes so that the vaccine could do the best possible job in protecting your body from the virus. You should get it at a certain age, and there's a certain amount given so that it works the best. Interesting to note, the vaccine was also only recommended for girls and young women. Only later, the vaccine recommendation included boys and young men. Current HPV rates, HPV vaccine, and dosing regimen. HPV is spread through all types of sexual activity, including vaginal, anal, and oral sex. 80% of people will get HPV in their lifetime. In the US, there are actually higher rates of men with HPV than women. How well does the HPV vaccine actually work? The HPV vaccination can prevent over 90% of HPV cancers. In the US, more than 4,000 women die of cervical cancer every year, even with screening and treatment. And almost 35,000 men and women are diagnosed with a cancer caused by HPV. Since the vaccine, less people have been diagnosed with HPV-related vaginal and cervical cancer. There are also racial disparities seen in rates of cervical cancer among women, with Black women least likely to recover. Vaccination, regular screenings, early detection, follow-through, and anti-racist medical practice are needed for better health of all people. What is the vaccination schedule for the HPV vaccine? All children aged 11 to 12 years should get it because it makes the body immune before the start of sexual activity when they get older. There are 2 shots which are given 6 to 12 months apart. For those who are 15 years old, 3 shots should be given over 6 months. Those who are older than 15 and haven't gotten the vaccine should see a doctor right away to get the 3 shots. The vaccine is recommended up to age 26. So if you haven't gotten it yet, or if you haven't completed the dosage and you're in your late teens or early 20s, you should still see your doctor right away or go to a health center to get the vaccine. Vaccination success. How do we know that the vaccine actually works? Well, the rate of HPV infections that cause cancers and genital warts went down by 86% for teen girls. For young adult women, the rate went down by 71%. In addition, all women should start getting cervical cancer screenings once they turn 21 years old. The screening helps find cancer caused by HPV early on. However, there are other cancer-causing HPV infections that are not checked regularly, like infections that cause back of the throat, anal, and penile cancers. And remember, HPV doesn't only affect women, it affects everyone. Almost 4 out of 10 times, a cancer caused by HPV affects men. In the US, over 14,000 men get HPV cancers. HPV is very common. Remember, it is the most common sexually transmitted disease. Most people get it unknowingly, and they can also pass it on to others unknowingly. There is no way to tell whether someone with an HPV infection will develop cancer years later in their life. Therefore, it is very important to get the HPV vaccination, which protects your body against most HPV infections that can lead to cancer. Insurance usually covers the HPV vaccine, and Medicaid does cover it. Even though the HPV vaccine protects against most of the dangerous types of HPV, it does not protect against all types completely. So it is important to get screenings regularly, like the cervical cancer screening or pap smear, like mentioned earlier. Also, it does not mean you are protected against other STDs. So, in addition to the HPV vaccine, it is important to use barriers like condoms during vaginal, anal, and oral sex because it greatly lowers your risk of getting STDs or HIV, which can lead to more serious health problems. iPrevent is a resource for you. We provide information on how to stay healthy. We provide free condoms and lube, help with clinic appointments, and Medicaid enrollment. Give us a call at 504-418-4955, or you can also DM us on our social media accounts. Make sure to follow us on Instagram, Facebook, and Twitter. Thanks for watching, iPrevent viewers. Until next time.